Have you ever pondered on the possible toxicity of gentamicin to the kidneys? It's a question that might surprise some, but it's one that demands our attention. Gentamicin, a widely used antibiotic, has a hidden facet that many may not be aware of. It can in fact be toxic to the kidneys. How, you may ask? Well, it's all about how the drug behaves once inside our bodies. After administration, gentamicin is freely filtered by the glomeruli of the kidneys. However, a significant portion of the drug is also actively reabsorbed by the renal tubular cells. It is this reabsorption that leads to high intracellular concentrations of gentamicin, mainly in the cells of the proximal tubule. Now, this is where the plot thickens. Gentamicin, once inside these cells, induces the production of reactive oxygen species, leading to oxidative stress. This oxidative stress, in turn, results in cellular damage and apoptosis, or in simpler terms, cell death. This damage to the renal tubular cells is what manifests as nephrotoxicity, or toxicity to the kidneys. On top of this, gentamicin can also disrupt the cell's normal autophagy process. Autophagy is a vital cellular process where cells recycle their own components to provide necessary building blocks during periods of stress. By disrupting this process, gentamicin pushes the cells further down the path of damage and death. So, the question arises, how can healthcare professionals manage this potential toxicity? The answer lies in careful monitoring of gentamicin levels. It's essential to maintain therapeutic levels of the drug to effectively combat bacterial infections. However, it's equally important to avoid excess amounts that can lead to toxicity. To balance these two, regular blood tests are performed to monitor gentamicin levels. The timing of these tests is crucial, as gentamicin levels peak 1 hour after administration and reach their lowest point, or trough, just before the next dose. By carefully timing these tests, healthcare professionals can adjust the dosage to ensure efficacy while minimizing the risk of nephrotoxicity. In summary, while gentamicin is an effective antibiotic, it carries a risk of toxicity to the kidneys. This toxicity results from high intracellular concentrations of the drug in renal tubular cells, leading to oxidative stress, cell damage, and disruption of the autophagy process. However, through careful monitoring of gentamicin levels and appropriate dosage adjustments, healthcare professionals can manage this risk and ensure the safe and effective use of this important antibiotic.